Welcome back. Keeping an eye on your health today. February is American Heart Month, and according to the CDC, heart disease is the #1 killer in the United States. So joining us today is Dr. Joseph Imsais. He's a cardiologist from St. David's North Austin Medical Center to talk to us about the signs and symptoms of heart attacks. Thank you so much for being with us this afternoon.
Thank you for having me.
And I guess the rule of thumb is to pay attention to your body, know your body.
Yeah, the body is a very neat thing, and the point we want to make across is that you really need to listen to your body. A lot of times we'll have mild chest pain, chest discomfort, chest pressure. You know, you hear about classic signs of heart attack as someone sitting on your chest or an elephant sitting on your chest, but a lot of times if you talk to patients that have had heart attacks and you go back, they'll tell you, "Doc, a couple days before, a couple weeks before, I had this mild discomfort. I had a mild pressure that went away when I rested, or I got short of breath and I wasn't normally like that. This was a definite change." And so the point we're trying to make is if you have symptoms like that, you need to get it checked out, and preferably go straight to the emergency department. The emergency department is equipped with doctors and experts, and they can handle something like a heart attack efficiently and quickly. If you know of somebody in your family that's complaining of chest pain and chest pressure, they often may be in denial. So you really need to step it up and encourage them to go to the emergency room and have it looked at.
So that's a little about detection. How about prevention? I know obviously diet and exercise come into play. What are some of the things you can do to help prevent it before it happens?
Yes, diet, exercise are the key factors, and they will always be the key factors. Obviously, as we get older, we have no control over that. Being over the age of 50 puts males and females at risk. Having a family history of early heart disease, meaning a mother or father having heart attack or heart disease in their 50s, puts you at risk. Having risk factors such as high blood pressure, high cholesterol, diabetes, smoking history also puts you at increased risk. So all those things play a role. If you have any of those risk factors, you should really work with your doctor to try to get those under control.
Assuming you do have a heart attack and it's not fatal, what are some treatment options?
So heart attacks are treated in many different ways, but lifestyle modification is always the key. Again, controlling the risk factors, losing weight, exercising, being on an aspirin daily. For men over the age of 45, an aspirin, 81 milligrams, just a baby aspirin once a day, has been shown to reduce your risk of heart attack and stroke by 33%. This is whether you have a heart attack or not. So as long as you don't have any contraindications to taking an aspirin a day, we recommend that. And the contraindication would be bleeding or some kind of ulcer. So you should always check with your doctor. But controlling risk factors, if you've had a heart attack, you may not necessarily need a stent, but you will be on medications to control your blood pressure and cholesterol and medications such as aspirin.
Dr. Joseph Imsais with St. David's North Austin Medical Center. Thank you so much. St. David's, by the way, 6 acute care hospitals. All are chest pain accredited and received Pathway to Excellence status by the American Nurses Credentialing Center. Thank you so much for being with us.
Thank you for having me.